Welcome to the Physiology Case Scenarios Cardiovascular Series 2. This module deals with electrophysiology. Case 1. A calcium channel antagonist, diltiazem, was administered to an experimental animal to study cardiac electrophysiology. The tracing of the ventricular action potential shown below was taken before the intervention. The question is, which of the following changes will occur in the action potential following the administration of the drug? A. Slope of phase 0 will decrease. Duration of phase 2 will decrease. Resting membrane potential becomes unstable. Amplitude of action potential will increase. So here is a case where an experimental animal is subjected to a drug which blocks the calcium channels in the heart. Calcium channels play a very important role in the cardiac action potential and contraction. The ventricular action potential also is shown. This is a typical ventricular action potential having the designated phases. Phase 4 is the resting membrane potential, stable resting membrane potential. Phase 0 is a rapid action potential, the spike potential. Then the early repolarization is shown by phase 1, short duration phase 1. Then the prolonged plateau, phase 2. This is due to the calcium influx. It is during this phase the calcium enters from the ECF and from the sarcoplasmic reticulum. Calcium induced calcium influx causes a prolonged plateau and it also induces the ventricular muscle contraction. And the calcium here determines the force of the ventricular contraction. This is a very important phase, a long phase. Then it's followed by phase 3, that is the repolarization, and back to the resting membrane potential. So phase 4 followed by phase 0, 1, 2, 3, 4. This is the typical ventricular action potential. The question is, what is the effect of the calcium channel antagonist? Obviously, the phase 2 must be affected. Phase 0 is by the rapid sodium influx to the voltage gated sodium channels. Phase 2 is calcium, therefore B is the most likely answer. Resting membrane potential will not change. Amplitude of action potential also will not increase. It is the duration of phase 2 will decrease. This is very common to use calcium channel antagonist to decrease the force of the ventricular contraction, used for hypertension and so many other cases. The extension of the same case, trace is given, ventricular action potential. Case, what would be the effect of the drug on the heart of the animal, which we have already answered. Obviously, the calcium being very important role in the, it determines the force during the ventricular contraction. So A must be the answer. Decrease in the contractile force of the ventricle. It does not affect the vagal tone as such. Vagal tone is determined by the vagal nucleus, and decrease in the vagal tone will cause increase in the heart rate. Here, calcium channel antagonists usually decrease the heart rate at the heart level, not at the central level. So B is not the answer. Increase end diastolic volume. It cannot increase end diastolic volume because it has no effect on the venous return. It doesn't increase the venous return. The venous tone is not increased. In fact, it is decreased. Calcium channel blockers relax the smooth muscles. Increase in the afterload also is not a correct answer. So it is the decrease in the contractile force. Case 3. A 60-year-old man suddenly felt a crushing pain beneath the sternum. As he was ready for his breakfast, he became weak and began to sweat profusely. He was hospitalized, and the preliminary tests revealed that the patient had suffered a myocardial infarction. The patient subsequently developed cardiac rhythm abnormalities, arrhythmias, for which he was given drug quinidine, which is an antiarrhythmic drug, and this inhibited voltage gated sodium channels. Which of the following is the function of the voltage gated sodium channels during development of ventricular action potential? This we have seen in the previous question. Voltage gated sodium channels play an important role in the rapid sodium influx causing the action potential, phase 0. So the inward sodium current drives the membrane potential to plus 20, responsible for the brief period of repolarization immediately following phase 0. The inward sodium current balances the outward potassium current to cause phase 2. Increasing outward sodium current produces rapid repolarization. So the answer is very obvious. A. Inward sodium current drives the membrane potential to plus 20. The phase 0, the spike potential we have seen this is due to voltage gated sodium channels which open at the threshold. When the membrane potential changes to the threshold, the voltage gated sodium channels are activated at the threshold potential and it causes the rapid action potential to begin, which is followed, of course, by the small repolarization brief period, which is due to potassium efflux, and then the plateau. A 60-year-old patient, a known hypertensive, is on antihypertensive drugs. Since 1 year, he is complaining of increasing shortness of breath and concerns his cardiologist. The patient is put on digoxin, a cardiac glycoside, and is informed that the drug would improve the pumping efficacy of his heart, which is failing. The question is the drug would lead to which of the following sequences in the ventricular fiber to cause positive inotropic effect? So, this is a drug, digoxin, which was used previously. Nowadays, it's less used because there are better drugs for the failing heart. It's a cardiac glycoside which is supposed to increase the force of muscle contraction, that is ventricular contraction. Positive inotropic effect is an effect where the force of muscle contraction is increased. Question is what is the sequences? There is a sequence of events which lead to positive inotropic effect. Number 1, inhibition of sodium potassium pump. Increase sodium gradient across the cell. Decrease calcium efflux. Of course, that will lead to positive inotropic effect. Is it that, or is it inhibition of sodium potassium pump, decrease sodium gradient across the cell, and decrease calcium efflux? The third option is stimulation of sodium potassium pump, increase sodium gradient across the cell, increase calcium efflux. Stimulation of sodium potassium pump, decrease sodium gradient across the cell, and increase calcium efflux. If one doesn't know mechanism action of this drug, you can see what is the cause of a positive inotropic effect. We have already seen in the previous case that the positive inotropic effect or the force of contraction of the ventricular muscle depends on calcium. Here is calcium, the last one. More the intracellular calcium, more will be the force during the phase 2. The amount of calcium entering into the ventricular fiber is more. When there is a duration of the calcium availability is more, the force increases. So calcium determines the force. There are 2 decreased calcium efflux and 2 increased calcium efflux. If you look at the increased calcium efflux in the last C and D, the cell is losing calcium and it will not have the positive inotropic effect. It will have negative inotropic effect. So it must be the A and B. Calcium flux should decrease, so it should remain in the cell. Either it should be A or B. Now the third one, sodium gradient is increased in one case, decreased. If you are confused about that, look at the first. Inhibition of sodium potassium pump will increase the sodium gradient or decrease the sodium. We will answer that. The sodium potassium ATPase pump is a pump which is always acting in any cell in the body, especially those excitable cells. 3 sodium driven out and 2 potassium ions are driven in by the pump against the gradient. So that means there is a net loss of 1 positive ion. This causes a negativity. The cell becomes relatively negative inside and also maintains the sodium potassium across the cell after the action potential, because sodium would have entered, potassium would have left. So this is a very important pump, always active. If it is inhibited, there are 2 cases of inhibition. A and B, if it is inhibited, what will happen? More sodium is retained within the cell. Sodium is an extracellular ion, less within the cell. So when more sodium is retained within the cell, the gradient will decrease. Inhibition of sodium potassium pump will decrease the sodium gradient, and this will affect the calcium sodium exchange, which is of course not shown here. There's a sodium calcium exchanger in the cardiac cells, which after the action potential, or it is active always, exchanges sodium for calcium. It causes calcium to get out of the cell and sodium to come inside the cell. This is how the calcium exits the cell, because in the cardiac muscle the source of calcium for the contraction is extracellular, unlike in skeletal muscle where the calcium enters the sarcoplasmic reticulum. Here also it enters sarcoplasmic reticulum. In addition, the sodium calcium exchanger. Sodium calcium exchanger depends on the sodium gradient. Decreased sodium gradient will decrease the efficacy of this exchanger. So decreased sodium gradient will decrease the calcium sodium exchanger. There will be decreased calcium efflux. B is the correct answer.